Welcome to Module 5. This module helps you answer the question, what psychosocial or behavioral therapies are available for patients with substance use disorders? Psychosocial and behavioral therapies are about transforming a patient's interior and exterior life. Here's one way to visualize this. Imagine that wellness is like a wheel with the person in the middle. A person experiencing general well-being has many spokes extending outward, constructing a strong and sturdy wheel. These spokes connect the individual to their loved ones, to their community, to activities that they enjoy. As substance use disorders become more severe, however, people often lose some of these spokes or connections. Instead, they are frequently disconnected from people, from former hobbies and groups that they previously enjoyed. At its most severe, a person can begin to lose connectedness to anything that is not related to the substance use, ending up with only one spoke branching out from them to the substance. Psychosocial and behavioral therapies target these spokes. They generally seek to weaken the spoke between the person and the substance, and simultaneously they help restore old spokes, or they add new ones. In this module, you will learn about the neurobiology of recovery, along with the self-help approaches and evidence-based therapies that help the individual and their family. Stick around for the next lesson.